So welcome all of you. Now you see in some of the places, in some of the areas you will observe all throughout your career that in this journey at some time you will feel that there is like lot of information is being thrown at you and you have to just gulp and all, right? But the thing is we don't have to mug up all the all the points, all the topics. Mugging up will not help in the longer run. Okay, the idea is we have to digest part by part. We have to understand the concept. Okay, so we have to make a very strong foundation based on the concepts, and those concepts which we build now will eventually help us in the clinical sciences, because eventually we have to become a clinician, right? Eventually you will be sitting in a very big hospital and you will be very big consultant over there. But to reach there, you have to pass through this process. You remember in the very beginning of your school, when you started the primary education, right? You learned that time ABCD, right? But now you're using that ABCD to write the words, to write the essays, poems and whatnot. So similar way, we are going to start with the basic sciences. We will build our strong foundation based on the concepts, and then we will be using all those concepts. We will be connecting the dots to the clinical aspects, right? So see, at the end of the day, you will be awarded this medical degree. But now, as ma'am has already told, and you are aware that now pattern is changing. Now the exam is, we have the new CBME pattern, and eventually next exam will be there, right? So what almost every doctor in a country wants, he wants to take a big leap, right? From like MBBS to he wants to become a big specialist. Of course, big leap, and there's a big motivation also, right? But in between we have to pass through one exam which is called as next, right? Now the next will be there, and this is just a change in pattern. It is not the only change, even the currency was also changed some time back, if you remember. So similarly there is another change. Now it is in the form of exam, right? So what will be the change and how it is going to impact you? It is very important for us to understand. I will not go into too much of detail because mostly the details are clear by now, but just to put silent features in line, that we have the pre-final year, and after final year we will be having one exam, right? Usually that exam was university exam, and after that there was internship, and after the internship there was NEET exam. But now the next exam will be held 1 year prior. So to summarize, we have 1 year less to write the similar type of exam. Okay, so we have less time to prepare, and obviously I know it is not going to be easy. All right, so what we can do, as ma'am already told, we have to start early. So early planning and preparation is essential to stay safe, isn't it? So now question comes to it, how to prepare? See, we can prepare, it is entirely your choice. Either you can go for group study or you can go for self study also. All right, so thing is, but for the group study, if at all you are opting to go for that, let me tell you what we think that we are gonna do, and what we usually do is this. So there should not be a difference, right? If you plan to study together, then don't waste your time in gossiping around. Okay, then focus on studying only. All right, so it is entirely up to you whether you go for self study or group study. But only thing what you should always focus on is you should not go without proper planning and without organized notes. Okay, and at each step we will be guiding you. It is very important, because if suppose you start without proper planning and you did not make any organized notes, then what will happen? Just before the exam everything will be some hodgepodge, right? And you will be in a state of anxiety, nervousness, you will be confused, right? And that time whatever preparation you may be having, but your output will be very less because of less efficiency, because of the nervousness. So it is a kind of a vicious cycle. So you have to break that vicious cycle. I hope you're understanding the point. Okay, and in this medical curriculum now, in this medical life, discipline is definitely required along with sincerity. Okay, so just be prepared now to put all the hard work, all the smart work also. Okay, But I have seen to some of the students who are really brilliant, but they are kind of first doctors in their family, so they do not have any seniors to guide them. Okay, so they are in just this thought process, like someone, if someone was there who could teach us, who could tell us that what is to be done, when these things to be done, right? Basically the guidance they lack, right? So we are there for you. Let me tell you, because this is not going to be that formal. The class that you are going to attend in your college level, that will be kind of a formal, and you have a little bit gap between you and the professor, and you can't talk to them like anything, you can't ask, right? There's a gap, there's some kind of barrier is there. But with us, definitely we will also maintain the decorum of the class. But within the decorum of the class, we give freedom to our student that we are accessible, so that if you have any kind of doubt, it can be academic doubt, or even if some non-academic doubt but relevant, that you can also ask. Okay. So dear students, now you see, if you go without preparation, volume will become so much, you see, overwhelming, that you have a tendency to give up, right? But now just compare this scenario, that with proper guidance and with proper planning, and you did all the hard work all throughout the year. Now just before the exam, the state will be different. Don't you agree? Yes. So just before the exam, everything is streamlined. You just have to revise him. And as ma'am said, that these things will be your weapons, right? And you will be completing syllabus before everyone else. It will give you a boost. Now, dear students, let me talk a little bit about the difference of the pattern. Now change, you see, anatomy will remain same, but the way of asking questions will be different, because now the direct question can be like, it will be like, what structure will pass through different foramen, right? We have the foramen in the skull, which we will come to know later on. And direct answer will be like, one nerve is there that will be passing through this rotundum, you know, maxillary nerve is the answer, that we will come to know later why it is there. But now the indirect way of the asking question will be clinically integrated. Clinically integrated means patient comes with a history. Now it is as if you are sitting in a OPD or in a hospital clinic, right? And a patient is coming to you, and you looking at the history with the features and everything, you are trying to make a diagnosis. Are you understanding? So basically using the anatomic knowledge with the clinical aspects. That is the difference between the direct questions and integrated questions, right? Now patient coming to you, let us just look at this question. No problem, even if you are right now not in a position to solve the question, that is okay. But just look at question. So 60-year-old man with the known history of lung cancer. Okay. Now just imagine you are sitting in an OPD and patient comes with a known history of lung cancer, and he is a 60-year-old man, and his presentation is hoarseness of the voice and the difficulty in swallowing, right? This is the presenting features, right? But when you examine, you come to know there is no problem in the vision, no problem in the hearing. So those pathways are completely all right. And there is loss of gag reflex. Gag reflex we test with by putting something in the posterior aspect of the tongue, and then there will be gag coming, right? That is what is called as gag reflex. And when the patient is prompted to say ah, you observe, है ना? You must have seen also in the OPD or somewhere कि आ करो, मुंह खोलो, जुब्बा बाहर निकालो, है ना? ऐसे बोलते हैं. So patient को बोलेंगे आ करो, and then you observe inside, the uvula will be deviated, right? If the uvula is deviated or not, that you have to observe. All right. And his left shoulder is drooped, and the strength is reduced during the shoulder shrug testing, right? And chest X-ray MRI that shows the multiple lesion consistent with the metastasis. Now the question is, which anatomical structure will be most likely responsible for the patient symptom? Now this is the given scenario, even though we have not studied any part of it, but just let me help you. When we say hoarseness, it is related to the voice, and we all know what is, now you tell me from your PMT days, what is the sound box? Which organ is called as sound box? If the hoarseness of voice is there, which organ is affected here? So larynx, okay, very good. Larynx is affected in this patient. Because the hoarseness is given, we can assume hoarseness is because of the larynx involvement. And the difficulty in swallowing is the pharyngeal involvement, okay. And when we say the uvula is deviated, that is palatal involvement is also there, okay. That is the palatal involvement. So now are you able to understand? patient will come with the problems only. But as a doctor, it is your duty to integrate with the body parts. So now you can say, because of this given information, we are sure that the patient is having the laryngeal, pharyngeal and the palatal involvement, right? We are sure that patient is having the laryngeal, pharyngeal and palatal involvement. And because of that, when we study the cranial nerves later, then we will be able to understand that it is the vagus nerve basically, along with the one part of 11th nerve which is supplying these parts. Okay, and so now based on this information we are sure that it is, and loss of gag reflex is also there, and for the gag reflex we know it is the 9th, 10th and 11th nerve which is affected. Now gag reflex means 9th nerve and 10th nerve is there. So that is, now we know for the 9th, 10th and 11th nerve there is a common foramen, there is jugular foramen, right? So do not worry right now that what type of question, and you may find little bit difficult also, but the idea is I just wanted to give you the taste that integrated question will be such that you have to use your anatomical knowledge and then you have to integrate with the clinical aspects. So now tell me, dear students, could you get the understanding, means the basic understanding, what is the meaning of integrated question and how as a doctor it will help you? Because eventually you will be seeing patients only, and patient will be coming with the clinical features only, and then as a doctor it is your duty to make the diagnosis and then you start the treatment, right? So could you understand the meaning? Bone is having these parts. This is called as shaft of bone. This is called as shaft of bone, and this is called as end of bone. Now you take your notebooks, take your pen and start drawing with me. I'll give you sufficient time also. This shaft of the bone is also called as diaphysis. This shaft of the bone is also called as diaphysis. And end of the bone is also called as epiphysis. End of the bone is also called as epiphysis. So shaft or diaphysis, end or epiphysis. All right. And in between here we have one plate of cartilage. In between here we have one plate of cartilage. What is the name of this cartilage plate? This is what is called as epiphyseal growth plate. This is what is called as epiphyseal growth plate. Okay, you take your time, draw the diagram, but once you are done, please let me know, then I will proceed further. Okay, so this is how we are going to study. I'll explain. First I have given you the diagram. You make this much diagram, and once you are done, you write in the chat box either yes or done or something, so that I come to know that you guys are done, and then I will proceed further. Because here we are going, we are planning to go at such a speed so that it makes clear understanding in your mind. Idea is not to finish the syllabus. Idea is to make you guys understand the concepts. Okay. So we will go at an optimum pace, not too much slow, not too much fast. Okay, done. Very good. Yeah, after this I am planning to take upper limb. Okay. Most of the students, they have told in the group already that upper limb has started. Okay. So after that we'll start upper limb after general anatomy. But those who are doing lower limb, in the meanwhile, they can make use of the recorded lectures, but later we will catch up. Right. Now dear students, this epiphyseal growth plate, what we have written here, it is actually hyaline cartilage. What is this? This is actually made up of hyaline cartilage. Now you must be thinking that why this cartilage plate, why it is there in between the bony areas? Like we have bone, but in between, you see, this is bony area, this is bony area, this is bony area, but then hyaline cartilage is there. Why cartilage has come in between? It is actually cartilage has not come in between. It is the bone which has come in between. Let me describe. Okay. Understand this part carefully. See, there are certain bones like which will follow the membranous ossification. What is that? For the membranous ossification, we do not have any preformed model of the bones. Okay, there is one way of ossification where we do not have preformed model is not there. So we have the flat membranes. In the flat membranes, the osteoblast, the bone forming cells. Okay, osteoblast will come and they will make the bony tissue within the membrane and they will make the flat bones. So flat bones as in the calvaria, the skull bones, flat bones of the skull vault, that will be made by membranous ossification, all right. And you can say there is another type of ossification where we have the cartilaginous ossification. In case of cartilaginous ossification, you just imagine this pen. Suppose this is representing the bone. This is whole. It is a preformed model of a bone. For example, it may be having a shape of future humerus, but it is not bony. It is cartilaginous. Could you understand? In this type of ossification, where we are calling it as cartilaginous ossification, there will be a model made up of cartilage. It will be having the shape of the bone, but it is not bony as of now. So it is made up of complete hyaline cartilage. Are you understanding? It may be having shape of humerus, right? So what will happen in the intrauterine life, that means before birth, the shaft becomes, it starts becoming bony. That means it starts ossification. Now because this center is the first to start ossification, in this center, it is the first to ossify. That is why this is described as primary center of ossification. So now primary center of ossification has come, means we can say some part of it has become bony. We can say some part of it has become bony, this much part, shaft part has become bony, but the ends are still cartilaginous, and the baby is born, After that, there will be different age. At different age, different end of the bone, they start ossification. When the ends are ossifying, this is coming later. That is why this center is called as secondary center of ossification. That is why it is called as secondary center of ossification. Could you follow this? So now this bone was already formed before birth, and this ends, they appear after birth, but still there is little bit hyaline cartilage plate available. That hyaline cartilage plate is called as epiphyseal growth plate, right? So what I have told, let me give you one quick review and please tell me, have you understood this concept or not? So let me tell you one very simple way, that we have a bone which is actually made up of cartilage in the intrauterine life. That means we have the humerus, example, humerus bone, but it is not made up of bone, it is made up of cartilage everywhere. Okay, so let me just describe this way. So this is, suppose, the bone which is made up of cartilage everywhere. Okay, now in the intrauterine life, this part becomes bony. So this has become bone. Because this part has become bone first, the center is called as primary center of ossification. Primary center of ossification. Okay, and this much portion here, later in life, after the baby is born with this configuration, ends are not ossified, ends are still cartilaginous. But after that, at different age, this ends will start becoming ossified like this. Do you appreciate? The ends will become ossified. So we can say this much cartilage is still there, but rest has become bony. This has become bone. Now this part of the bone, it has become bony later. That's why it is called as secondary center. But this cartilage plate is still there. Are you understanding now? Because this cartilage plate was already there. It is the bone which has come on both the sides. Could you understand better what is the meaning of cartilaginous ossification? Because we have the model made up of cartilage. In this part, the bone is getting ossified. Please tell in the chat box, this much part is clear. Could you understand now? Yes. So why we are calling this epiphyseal plate, which is still there, why we are calling it as growth plate? Why? Because why we are calling this plate as a growth plate? Can you please tell? See, this hyaline cartilage will increase in length. Okay, this hyaline cartilage will increase in length. Okay, initially this much is there, then it will increase in length this much, like this much it has increased. But then what will happen? After that, some part of it will become bony, like this. It will be converted into bone. Then what will happen further? Again cartilage will grow. Both side we have bone, no? Now what will happen? Again the cartilage will grow, like this. Now again cartilage has grown, and after that again some part of it will become bony. Are you able to follow? So cartilage will grow, some part becomes bony. Cartilage will grow, some part will become bony. It's a cycle. Till when? Till this part of the bone and this part of the bone will fuse. Okay, till the time comes when this part of the bone will fuse with this part of the bone. Are you understanding? After that, no more cartilage is left. If no more cartilage is left, now can the bone grow further? This if this cartilage plate is used up, time will come around, like different ages there, है ना? One time will come when the whole of the cartilage plate is used up. After that, can the bone grow in length? Tell me, will the bone grow? If the person wants to increase his height and he takes so much of Bournvita or another energy drinks or something, if the ossification is done already, if the epiphyses are fused already, will their height be increased? If they give some secret of energy, boost and other products, so that is advertisement is okay. But as at anatomical level, as a doctor, what is your opinion? If you suppose right now you have started your journey, but now people will start asking for your opinion, that Dr. Saab, what do you think? What we should give? So after the epiphyseal fusion has taken place, after the hyaline cartilage plate is used up, can the height grow? No, of course not. Very good. Very good to see that your concept is clear. So could you visualize this part? Yes. Now let me take you back to that particular diagram which we started here, that we have, this is the end of the bone and this is the shaft of the bone. Okay. And let me talk about very important phenomenon here. What is that? After that I will write the notes, but there is one artery which is called as nutrient artery for the bone. So we have this artery which is nutrient artery for the bone. Okay, nutrient artery. It will enter the bone, it will enter deeply into the medullary cavity. Okay, and here we have one artery which is coming for the ends of the bone. This artery is coming for the ends of the bone. That's why we can call this artery as epiphyseal artery. We can call this artery as epiphyseal artery. Okay. And now nutrient artery will give ascending and descending branches. This nutrient artery is giving ascending branches and descending branches. These ascending branches, they are going to approach for the ends. They are approaching the ends. Why? Because they want to reach the epiphyseal part, and there they will anastomose with the epiphyseal artery. So these arteries are approaching the end in order to anastomose with the epiphyseal artery. But look at very carefully this part here. that these arteries, in order to reach the epiphyseal part, they have to pass through epiphyseal cartilage. Now epiphyseal growth plate is what type of cartilage? Hyaline cartilage. Hyaline cartilage has got a property. What is the property of the hyaline cartilage? The property is it is avascular. Avascular means no blood supply. So if this cartilage does not have any blood supply, will it allow blood vessel to pass through it? No. If it will not allow blood vessel to pass through it, then how the blood vessel will manage? This blood vessel has to take a U-turn. This blood vessel has to take a U-turn like this. Okay. This arrangement is called as hairpin bend arrangement. This arrangement is called as hairpin bend arrangement. Like this. Okay. Now you tell me one general thing. Suppose you are going somewhere in your dream car. Okay. You just imagine you are going somewhere in your dream car. So how are you feeling? You are going somewhere in a dream car. How is the feeling? Good, na? Okay, very good. Keep on enjoying. But let me ask you one thing. Now after a while you have to take a U-turn. At the U-turn, what will you do? Will you increase the speed or will you decrease the speed? So you have to take a U-turn. What will you do? Will you increase the speed or will you decrease the speed? See, normal people will decrease the speed. Okay. There will be some khatro ke khiladi, they will increase the speed. That is okay. But right now we are talking about the normal persons. Okay. So the normal persons means they will reduce the speed. Okay. So now we can assume that at the level of where hairpin bends are there, the speed of the blood is less, or you can say the blood flow is sluggish. Okay. It is sluggish or slow. This is one part. Okay. Now another part. Suppose you are going on a bus. You want to get down on a moving bus. Okay. You want to get down from a moving bus. Now at which point you will choose to get down? When the speed of the bus is very high or when the speed of the bus is very low? Bus is moving. It is not stopping. But what speed will you prefer to get down? Obviously when the speed is very less, it is highly likely that we will try to get down at that point. So in a similar way, now just imagine. Suppose in some part of body we have some infection is there already. That infectious agent, it can be bacteria, fungus, virus, whatever. That pathogenic agent which is already there in the bloodstream. Suppose, okay. Now it can travel with the bloodstream. It can affect any part of bone. That is true. It can affect any part of bone. But which part will be most likely to be affected? Where the blood flow is slow or where the blood flow is high? Tell me, where the blood flow is slow or high? Obviously at the slow. That means where we have the hairpin bend, this part of the bone is most likely to be affected. Don't you agree? Tell me students, if I say this part of the bone is called as metaphysis. This part of the bone is called as metaphysis, where we have hairpin bend arrangement. Now tell me, if I ask you, which is the most common site of infection, bone infection? Bone infection is termed osteomyelitis. Osteo means bone, myelum means the marrow part, and itis means inflammation. So osteomyelitis, which is the most common site for osteomyelitis? What will be your answer? Epiphysis, diaphysis or metaphysis? Write your answer in the chat box. Which part of the bone is the most common site for osteomyelitis? Is it the diaphysis, metaphysis or epiphysis? Very good. Very good. So basically you could understand the concept, right? It is not that simply, see, there is one line. It's only one line. Metaphysis is the most common site of osteomyelitis. But idea is not to mug up. There is hold together, there is a difference between mugging up and understanding and remembering. See, we will understand and we will remember. This is a different process. Mugging up is when we don't have any idea. We simply mug it up. That we don't have to do. रट्टा नहीं मारना है, हमें चीजों को समझना है, समझ के कंसेप्ट बना के फिर याद करना है, वो डिफरेंट है. Yes. So you could understand this whole point and you could understand the concept. Those who could understand and those who could enjoy this particular concept and learning this much part in a logical manner, give me quick thumbs up, either thumbs up or smiley or anything. So that I come to know that, okay, who else is also, you see, now energetic and now excited about all this. Yes? Because now I will write one more word here and then I will ask you, what is the reason for that? Very good, beta. Very good. Good to see. Good to see all of you. You see, one thing you are understanding, you are enjoying, and also you are interacting. And let me tell you, when you attend the class in a passive manner, you are simply attending and listening and nothing else, you will learn. There is no harm. But then if you are learning in an active manner, you will definitely learn better way and you will remember for the longer duration. That I can guarantee. Okay. So always, not only anatomy, all the classes, right? So all the classes you must attend with the attentiveness, right? So what I have told Megha, what I have told, let me summarize this and then I will add one more point that I said, that at the level of metaphysis, hairpin bends will be seen. Why hairpin bends will be seen? Because these vessels, they could not cross the growth plate. Why? Because growth plate was made up of hyaline cartilage. Hyaline cartilage is avascular. It will not allow blood vessel to pass through. So hairpin bend will be seen. And we know at the hairpin bend, because of the arrangement, just like U-turn, the blood flow will become sluggish, slow. And that is why any infectious agent will find it easy to get down from here. And then immediately it will involve the metaphysis. That is the part of the bone where it is seen. So that is the reason, now I am going to write, that is the reason that metaphysis is the most common, it is the most common site of, it is the most common site of osteomyelitis, most common site of osteomyelitis in children, Now if you guys can tell me, rest of the part we have already learned, but if you guys can tell me why in children, why not in adults? Because in children we have the growth plate available. I told you that after a while, like one age will come when the growth plate is completely used up. After that, now in adulthood, the bones cannot grow further. Why? Because the growth plate is absent. If growth plate is absent, hairpin bend will be seen? No. Because what is the reason for the hairpin bend? Growth plate. If growth plate you remove, then no hairpin bend. Yes, that is true. Then they will become straight vessel. Yes, that is true. So if they become straight vessel, that whole idea of bacteria getting dislodged here will be gone now. Could you understand? Yes. Very good. Very good, beta. I am happy. I am happy to see you guys answering. So that it was a bingo. You got the concept very clear in your mind, right? So right now what we have learned so far, what are the parts of the bone. So we have shaft is there, which is called as diaphysis. We have end, which is called as epiphysis, and we have metaphysis, right? Also we have got the understanding about the blood flow. What is the blood supply for the long bone? Two arteries I have already written, nutrient artery and epiphyseal artery. But let me tell you, there is one outer covering of the bone. Can you tell me from your NEET UG knowledge, from your NEET UG knowledge, if you can tell me that there is one layer, outer covering of the bone, what is that called as? Perichondrium or periosteum? We know it is periosteum. We know it is periosteum. So if this periosteum is there, along the periosteum, we have one artery coming. What should be the name of the artery? The name of the artery should be periosteal artery. Periosteal artery. Yes. So now this is the picture that you have seen. And if I ask you, what is your logic? For the shaft, we have periosteum artery coming. Yes. We have nutrient artery also coming. Yes. Now, who will be supplying outer part? Outer cortex of the bone will be supplied by periosteal or the nutrient. Who will be supplying? You tell me. Look at the diagram carefully and tell me, outer cortex of the bone will be supplied by periosteal artery or nutrient artery. Who will be supplying here? Periosteal artery. Very good. Periosteal artery. Very good. So I hope you could understand this, and also let me add one artery over here. For the metaphysis, we have some arteries coming to the metaphysis, which is called as metaphyseal artery. Metaphyseal artery. So right now we have learned about the parts of the bone. All the parts are clear. Now just let me tell you what is metaphysis. Metaphysis is a part of diaphysis only, but towards epiphysis. So we can simply say, what is metaphysis? You see, you check in the diagram and then you will realize metaphysis is the epiphyseal end of diaphysis, because it belongs to diaphysis only. But which part of diaphysis? Towards epiphysis. That's why we are saying epiphyseal end. Epiphysis की तरफ डायफाइसिस का जो पार्ट है उसी को हम मेटाफाइसिस कह रहे हैं. एंड टू दोज स्टूडेंट्स हु डू नॉट अंडरस्टैंड हिंदी, लेट मी एश्योर यू, इवन इफ आई एम टेलिंग समथिंग इन हिंदी, दैट मीन्स आई हैव ऑलरेडी डिस्क्राइब दैट पार्ट इन इंग्लिश. सो यू विल नॉट मिस एनीथिंग. Everything will be definitely covered in English, and it will be covered first in English only, right? So metaphysis is the epiphyseal end of diaphysis. Is that okay? See this diagram now. Suppose today you have been posted in the Department of Radiology. Okay, there you have to report this X-ray. You have given this X-ray. You have to put the reporting over here. What will you write? What will you write? You will see that even the carpal bones, see this carpal bones are yet to appear. Can you see? Carpal bones are yet to appear. That means it is a normal age, normal X-ray of very young age, because time will come, these carpal bones will be completely ossified, है ना? Now look at the metacarpal. First metacarpal, second, third, fourth, fifth. These are metacarpals. But look at the metacarpal, you observe it clearly, and then you will come to know that it is the first metacarpal where the epiphysis is only present at the base. But second to fifth, these all are such that where the epiphysis is present on the head. Are you understanding? Please tell me, students, could you, this point is very, very important. So please tell me in the chat box, did you understand? First metacarpal base is the normal epiphysis. Second to fifth metacarpal head is the normal epiphysis. This is normal. It is present in everyone. Could you understand this? So suppose you are getting this type of X-ray. You are reporting normal, normal, normal. Suddenly you get this X-ray like this. Now what will you observe? You will observe here everything is normal because head is showing the epiphysis, and normally it should show the epiphysis. That is true. For the first metacarpal, base is present. Yes, base is present now. So base should be present. That is normal. But here, along with the base, head is also present as a epiphysis. So normally we do not expect this. Normally this is not present. So we can say this is not always present. This is sometimes present. But when present, it will be additional. It will be some extra. Are you understanding now? This type of epiphysis is called as aberrant. This type of epiphysis is called as aberrant. Could you understand the aberrant meaning now? If you have understood the aberrant epiphysis meaning, let me take one more X-ray. So if you take this X-ray, again you can see one epiphysis is present in the head of the first metacarpal. You will label it as aberrant epiphysis. But these aberrant epiphysis, they might confuse with the fracture also. So to overrule, to make a proper diagnosis, then you have to look at the clinical feature also. And then you will correlate clinically whether the history is there or not there, what other complaints are there, why the patient has come. That is a different story. But at this level, an X-ray, one of the differential diagnosis will be aberrant epiphysis. Could you understand this? Yes? And after that, suppose now one question for all of you. Now you guys will tell, okay, this X-ray is given, observe this carefully and tell me, is it normal or aberrant, and with reason. This is a question for all of you, question for all the house. Everyone should answer. Tell me, is it normal or aberrant, and with reason also. Why it is normal or why it is aberrant. Let me see who can answer this question. Let me see who has understood this concept clearly. Bolo, kya answer hai? What do you think should be the answer here? Is it normal or aberrant? Tell me. You have to observe everywhere. Okay, so now let me tell you something here. When you observe the first metacarpal, you observe the base is normal. Yes. Head is not there, which is normal. Yes. For the other, see here. Here you can see the head end, which is normal. Yes. But the base of the second is present now. Base of the second should be present. No. So it is also aberrant. It is also aberrant. Very good. Shabash Adit. Yes. Bhavya. Nitin. Swapnil. Very good. So most of you have identified this, that this is nothing but aberrant, because aberrant ke liye we will not only focus on the first, we will see this also. This is also part of human body. So either the head of the first metacarpal or the base of second to fifth metacarpal, these can also be aberrant. Now tell me, after this discussion, is it clear in your mind what is the meaning of aberrant? If it is present, it will be extra. And where it will be present? Either the head of first metacarpal or the base of second to fifth metacarpal. Could you correlate this? Now that we are done with this part, let me give you the notes. Let us finish our notes then. Aberrant epiphysis is not always present, first of all. It is not always present. And if present, it will be extra. It will be extra. Okay. And what will be the example? What will be the example? Example will be head of first metacarpal or base of second to fifth metacarpal. Like this. So if you draw, suppose this is the metacarpal bone, this is also metacarpal bone, this is base, this is head, this is first, this is second to fifth. So normally base is normal and head is normal, like this is normal. If head is there or if base of these is there, this will be aberrant. This is the illustration. I hope this picture also gives you clear insight. If the base of first is present, normal. Head of others are present, normal. But if the head of the first is present, it is aberrant. And second to fifth base, again aberrant. Could you understand this pictorial representation? Now also tell me one quick feedback. Today's lecture was first lecture for you. So could you understand the concept? First feedback that I want to know. And also regarding the speed and flow. Is it okay? Or you want me to increase the speed or decrease the speed? Is it okay now? Optimum speed, not too much slow, not too much fast. We are able to cover the topics. Also we are able to understand. And also we are able to take the important notes. So you have to start building these habits. Okay, beta? And as and when I'll be guiding you, other faculties also, they will be guiding you all throughout. And also let me now again show you my number. Those who have joined late or you have not been become the part of that Damsonian exclusive group is there, WhatsApp tuition group. You please send me the message over here. Very good, beta. It is good to know. It is actually good to know. I'm very happy that I could start your this tuition journey with us with on a smooth note. Thank you so much, everyone.